because of the wisdom of others and being willing to incorporate it, that I recovered from Hashimoto's, which is the autoimmune attack on the thyroid. And my child recovered, in terms of, when I say that, I mean he lost the diagnosis of autism, and it took a lot of work and it took years, but he was able to recover to the point where he lost that diagnosis.
Hi, welcome back to Mother's Guide Through Autism podcast. I'm so excited with our guest today, Dr. Julie Logan. And I just have to give a quick background. I met Julie in California at the TACA conference, which is, it really highlights a lot for parents. And I was just thrilled to meet Julie. And I'm so excited about, Julie, your story and everything that you have to offer today. So welcome.
Thank you so much. It's been a pleasure.
Yes, so I'm going to dive right in, and let's begin with your personal journey of your own health struggles and how you came to be a physician after you yourself recovering from Hashimoto's autoimmune thyroiditis. Did I say that right?
Yes, you did. You did. Yes, it is. So before all this, I really did not intend ever to go into the medical field. I did have children on the young side, young by today's comparison, certainly. And when I was in college, I had a college dentist who put a bunch of amalgams in my teeth, and those are 50% mercury by weight. And I didn't think anything of it. Well, when I was pregnant with my second son, I woke up and I was choking down what felt like a pebble, and it was actually one of those amalgam fillings that had broken out of my mouth. And I did not know it was poison. I just thought, why would a physician put anything in my body that is toxic? It never occurred to me. So I went to this dentist, and he replaced it with another amalgam filling, which now we would know that you don't do that in a pregnant mother. So I got a massive dose of mercury. And after that, it's hard to say, like, what's the end stage pregnancy whenever you're miserable anyway? And what was my health was starting to just fall apart. So I had a lot of internal organ damage from that poisoning, a lot of psychiatric symptoms that were missed because I, delivered a baby, and you're in that postpartum period and people don't really know what's going on. So it wasn't until I actually was a patient of Dr. Joseph Mercola, who was practicing in Illinois, the Chicago area at that time. And he was the first person 7 months after my child was born who diagnosed the autoimmune thyroiditis. I mean, everything was falling apart, and I was being told it was all psychiatric postpartum, when in fact, like, I had major organ damage from the poisoning. So my child did not appear to be affected, but as he got older, around that 21 month period of time, some routine medical procedures happened, and then there was a sudden dramatic change in him, and he went overnight from being a normal, developing, happy little baby to looking just confused and miserable in his own body, lost all his language. I mean, it's a story that we've heard over and over and over again. So that is our story in terms of what happened. And then by the grace of God, leading me from, one practitioner to another practitioner, I was able to get support, medical support, like, prescription thyroid replacement for a time, and start on that journey of learning how to heal, changing my diet, taking super nutrients to push certain things that needed to happen to repair my body. And it's been a long journey, and there are parts of me that have not been the same. And I'm doing the best that I can, but I will say that because of the wisdom of others and being willing to incorporate it, that I recovered from Hashimoto's, which is the autoimmune attack on the thyroid. And my child recovered, in terms of, when I say that, I mean he lost the diagnosis of autism, and it took a lot of work and it took years, but he was able to recover to the point where he lost that diagnosis.
That is, I love stories with happy endings.
Yes.
But I know that getting from point A to the happy ending, to be, I know that there was a lot of pain and suffering in between that. And, I can just see your smile when you're saying, yeah, we're good now. But I also know that the journey is what is so difficult for all of us. And I love, though, that your story does offer hope, and it's really inspirational. And that's why I'm so excited to have you here today. When you're telling us about your journey of your older son being diagnosed with ADHD, and it was your younger son with autism.
Right.
Tell us a little bit more about that journey, and of course we know there's a happy ending, but some of the things that you did that helped your kids.
Sure. So it was the time that my younger son was being evaluated, diagnosed with autism. And this actually happened for us in the school setting. Like, it was never done by early intervention. We never had ABA. We never had all of that stuff that people are getting now. So I remember one of the people who was evaluating my younger son, watching my older son, who's 2 years older, running around, very dysregulated. And they said, he shows a lot of the signs of ADHD. And so it's just devastating. Like, there were 4 people in our family, and 3 of us had really serious health problems. And so, again, by the grace of God and thin threads, we got to know a chiropractor, and he said, I can help you with all of those things. And I, did not know whether to believe him or not, but literally we started getting adjusted, and I didn't know anything else. I didn't know anything about diet. I didn't know anything about biomedical at that point. Just getting adjusted 3 times a week, regulating the central nervous system, getting out of the stress response. My older son went back to school after 3 months of that, and no one has ever said he had any signs of ADHD from that moment forward. That was the end of it for him. And for me, I got off all the medication that I've been taking within about 4 months after starting that intensive chiropractic treatment protocol. And then for my younger son, that was a much longer journey, but he started speaking again after about that 3 or 4 month point, where it's like he had to start over, but he was starting over. And he went from being a raging, angry, screaming, tantruming, wordless, wild thing to being a little boy again, who had to relearn how to the basic words that he had learned before.
That is amazing. And in such a short time. I mean, wow, that is truly amazing. And I like to ask, I want to get into for you to share how the chiropractic care and the nutritional therapies, I know you said those helped you and your sons, but can you give us a little more information? Because I always like to come, because I'm a teacher and a mom and all the stuff. And so I'm thinking, okay, I bet a mom out there is thinking, okay, I want to know, like, what is it? What is the care that you have a little more specifically?
Sure. So we eliminated gluten, we eliminated dairy, we eliminated sugar, food dyes. Basically, my sons say we became health freaks. And they say we chewed on twigs and ate berries, which isn't exactly true, but we just went back to evolutionary type diet. Like, what did God put on the planet for us to eat? Good thing is that I grew up eating like that. And I guess over time, with having 2 little kids and being mostly alone, parenting alone, it just got really easy to do the drive-through McDonald's, and I had no idea how bad that was. And so we eliminated the fast food and most of the junk food, and really cleaned up that way. And it had a profound impact on all of us. Like, I was healing. From autoimmunity, I needed to eliminate gluten, dairy, and some other things. And so we just all ate like that. And my husband didn't get a choice. He had to eat like that too. So, and then, I mean, there was no roadmap. So I wasn't working with Dr. Reisman at that point. I knew who she was, but I never thought I would ever meet her. And then by the grace of God, again, we encountered people who were practicing the Andy Cutler chelation program. And that was not a prescription program back at that point. And then they were also working with environmental medicine, so treating mold illness. So my youngest son in his pre-K year was sent to the therapy center in one of the public schools with all the other kids who had special needs who were in pre-K that year. And that school was a mold-ridden, it was a brand new school, but it had gotten flooded. And at that point in time, I had started to work in the practicing environmental medicine, learning these things. And I'm like, wait a minute, we're treating teachers from this school, and my son is in that school. So we tested him. His mold exposure levels were sky high, treated him for mold according to the Ritchie Shoemaker protocol. And that was like, there are a couple things that were main game changers for him. Chiropractic care to start, changing the diet, treating him for the mold, and finally chelating the toxic mercury out of his body. Those were the four main things that transformed his life.
Wow. And I love the divine intervention that is part of your story about how you're actually treating teachers that were suffering. And me coming from public education, I can tell you some of those old buildings are filled with all kinds of goodies for our immune system. And I love that led you to that. And I'm sure the teachers were getting help then too.
They were, but they were also getting bullied, as you know, like, okay, we'll transfer you, but you can't say anything about this to anyone else. We won't admit what it is, but yeah, we'll transfer you. So it was tough for them. And I think of all the kids in that class, in the whole school, in fact, who were suffering with that.
Yeah. Yeah. And nobody knows, right? That's the thing that is, well, that's for another day. We could really go down that road.
Yeah, exactly.
So over the last few years, you have explored the connection between the chronic inflammatory, did I say that right? Response syndrome and the PAN and PANDAS symptoms. Tell us about that. So I know inflammation is a huge topic.
Yes. So it has its roots in those years I spent working in environmental medicine, looking at the way that Dr. Ritchie Shoemaker and some of the others evaluated the immune response. So there's a genetic piece. There are certain markers that then go into a diagnosis called CIRS, chronic inflammatory response syndrome, and it has its own diagnostic code. And so that condition of a overactive inflammatory response, it has multiple manifestations throughout the body, has been accepted as an entity. It is a result of Lyme disease. It's a result of mold illness. It can be a result of other things as well, but it's an endpoint. Like, you get here because something has triggered your immune system, and you also are susceptible to having these kinds of responses. So that's the genetic link. So then years later, so I have operated with this knowledge that mold is an issue, that heavy metals are an issue, that all these different things are issues and triggers for our immune system. And then it seemed like all of a sudden PANDAS just hit us. Like, we were not diagnosing it, but I don't actually think it was as prevalent 20 years ago when I started in this. And then over the last, I would want to say 5 years, maybe a little bit longer, it is just like now it seems like all the children have elements of this high degree of inflammation. And so I thought, what if CIRS, chronic inflammatory response syndrome, what if PANDAS and PANS are actually CIRS in a pediatric population? So back in 2018, I started testing every child who had PANS, PANDAS symptoms for the CIRS biomarkers. So there's a list of maybe 10 or 15 different things that were classically tested and found to be positive in Lyme and mold sufferers. Well, guess what? 100% of children with PANS, PANDAS symptoms have these inflammatory biomarkers, and they also have the genetic susceptibility.
Wow.
That changed my perspective to go this. So we're treating we're going after, well, is it mycoplasma or is it strep? Well, yes, but those, it's like the sprinkles on the frosting on the cupcake. It's something that got the body to boiling, at 210 degrees, and which is like mold, Lyme, and other inflammatory triggers. And then what we see is the last 2 degrees that was caused by, whatever the most recent infection was. So I don't want to minimize the impact of these recurrent infections, but we need to be looking, well, what if there's an exposure that is why everyone's tripping over now into that degree of inflammation?
Yes, because I've been around a while. My son is 30. And so some of I've learned so much doing this podcast and listening. And one of the questions that I get all the time is, well, why is autism on the rise? Why is autism an epidemic, considered an epidemic at this point, and projected to have half of all our kids diagnosed by 2025? And I'm like, well, this sounds like part, not all of it, but certainly a big piece of that puzzle. Would you agree with that?
I would. I think that there's more than one ingredient in the recipe, and each person has, like, maybe they have more cinnamon or they have more, so it's not even, but I think it's one of the major ingredients. So toxic overload, triggering an inflammatory response, could be an infectious trigger triggering an inflammatory response, but either way, we get to the inflammatory response and then it escalates.
Right. So typically we get our child diagnosed, and what should we be looking for as parents to know, like, if this is part of our personal recipe for our kids?
So if you're talking about mold?
Yeah, I'm talking about, okay, how do I know, like, where do I start? Like, my child's just diagnosed. And I know that every child, certainly on the spectrum, is an individual, has genetic factors, has all these things to look at. But as a parent, I don't know this. I don't know a lot.
Right.
I'm overwhelmed with this new diagnosis. And I'm like, and it's because I coach moms. And I'm asking that because I think most of our listeners are like, I don't know what to do. What do I do?
Right. So the first thing I would do is I would work with a biomedical or functional medical provider, because what we're trained to look for these things. So we know it's not a million different factors. It's more like 4 or 5 major areas that could be the smoking gun, or some combination of all of them. It's not, like I said, it's not a million different possibilities. So our job when we're interviewing a parent is to find out for this child what seems to be the biggest environmental trigger, the biggest injury, if you will, that insulted the immune system. So what's the original insult? And sometimes the parents know, like, they'll come in and they'll say, my story, my child was normal until, and they know there's a point in time that makes it pretty obvious who's the biggest smoking gun. Sometimes they don't know. And then that's when I start looking for, okay, are you in a moldy house? Have you ever smelled a musty smell? Do you have symptoms in your own house? Did these symptoms start after you moved in or moved out of, a given building? For Lyme infection, which is common, that we'll ask some questions about that as well. But often parents will know, well, they'll like, hey, my brother or I have Lyme disease. So there are clues in the history. And then we look at the genetics of detoxification, of methylation, of some of these processes that we know are so important for brain function. So those are the kind of, I would say, the big things that we're looking for.
Okay. Yeah, that helps. I think anyone listening to this that gives anyone listening a good beginning, at least to know where to begin and what questions to ask. So yeah, it's very helpful. What did you discover in the process of healing and recovery?
How much time do we have?
Yeah, I was going to say, that's a big question.
So, broad question. I discovered, I guess, that probably like many parents, that you suffer this unbearable anguish of watching your child suffer, feeling helpless, feeling powerless. And when you find something to latch onto that helps, not only does it help you, but it gives your suffering meaning and it gives it more purpose because you can turn around and help other people. And so you want to spread the good news, if you will, so that you can share it with everyone and you can help as many people as possible. So that is a big thing in terms of like clinical things and things that work and things that help. I mean, I've learned so many helpful things that I can share with other parents that I know or people who are my patients. But I think one of the big things is you are suffering. You didn't get a choice about that. But to use that suffering to say, you know what, I am not helpless. I'm going to do something about this. And in so doing, you gain hope and you gain the ability to empower other people as well.
Oh, whew. That's powerful. Yeah, I agree. I agree. And there so many of the moms that I interview are doing exactly that. Like they have found something. And you just want to help as many people as you can, because it's like you found the gold, right? Like, who can I help with this information?
Yeah.
Speaking of that, can you share with us some of the success stories of your patients?
Sure. And without giving names, I would say that by the time families come to us, they've self-selected. So the children who are kind of high functioning children who are getting by with the therapies and whatnot, they probably don't come to us because it's expensive, insurance doesn't cover it, and they're getting by. So I think we tend to get the more seriously affected children. And so I would say about 25% of that group goes on to lose the diagnosis entirely. And about 25% of them, we are banging our heads against a wall and we're all like, these are the ones that we can't go to sleep at night because we don't know how to help them, or we're doing everything that we know to do and it still isn't enough. And then there's that 50% in the middle for whom we can make dramatic improvements and really help them. But we don't have everything we need currently in today's toolbox to help them lose the diagnosis. So the 25% that goes on to lose the diagnosis, sometimes it seems like it's easy, if you will, like, oh my gosh, really? So all it took was methyl B12 shots and getting rid of gluten and dairy, and you are just, leaping and bounding. Those are the things that keep us going, I think. Often though, it takes a lot more. And so the parents I have so much respect for their courage, for their persistence, for their willingness to deal with their oppositional child and say, oh no, you are going to take these supplements and you are going to eat the food that I give you. And no, I'm not going to be bullied by you into, giving you fast food or whatever. And those patients do well also. And sometimes the parents are the ones saying, hey, I've been researching and I've heard about this therapy. Can you help us obtain it? And it's such a joy to be able to work with those people to say, yes, absolutely. How can we open the doors for you to get your hands on things that might help your child? So I guess I don't know if that's what you were looking for in that answer.
Yeah, I think that's great, because I think those percentages, first of all, are pretty high with, you think really, okay, basically 75% of your patients are going to see some improvement, if not a recovery. And then there's that, the bottom 25 that are the ones that are the struggle. But I think we're learning so much more about autism. At least, like I said, I've been around a while, and I can tell you that there's so much more knowledge and hope out there now. And, yes, we knew about, somewhat about diet, but it was just like basic information, where now we have professionals. Like if I were to go backwards, and Joseph were, 3 to 5, I would be doing what you're talking about, because
Exactly.
that would have made a difference for Joseph. But, you don't know what you don't know.
Exactly.
So yes, you definitely answered that question. What are the what are some of the biggest lessons you've learned on the path of healing as a mother and a physician?
So I would go back to the willingness of, as a parent, being willing to do whatever it takes. Because I would say the difference between success, by success, I mean improving a child's life. I can't use the word recovery, but perhaps even to the point that they lose the diagnosis, they go to high school, they go to college, they can have a career, they can live independently, right? That's our goal for our children, and fulfillment in relationships. The difference in some families, I think, is the willingness of the parents to put their foot down and say, you are going to do this. Those who are willing to do that are the ones who are likely to have the best outcome. And even if they don't, they know they did everything that they could do. The parents who are bullied by their child or intimidated by their child, or who, well, I don't know how to make them take supplements, or, well, they'll have a meltdown that lasts for 2 hours if we don't go to McDonald's. And I'm like, you know what, if you look at every intervention that you're doing as, think of, God forbid, that a child has cancer, what would you not do? What painful treatment would you not do if you knew your child would die without it? Yeah. And I think of autism and some of the suffering that I see, I think of it as like a living death. Like, these kids are suffering so much inside their own body. So what would we not do to ease that? So if there's anything I could say, it would be, go the distance. If you have to hold your child down and squirt stuff in their mouth, do it. Yeah. Don't take no for an answer. If you have to, like, not take them to McDonald's or not buy certain foods, or make sure no one in the house has those foods because they'll climb into any cupboard where they might be, why would you not do that? So think of everything as, I'm willing to go the distance because I'm saving your life.
Yes. Yes, I feel that. And I love your passion for that. And yes, I always said that as long as it wasn't literally hurting Joseph, that we were going to try it. And I do believe that's why my son is living independently now. And you said earlier, it's a lot of work. It is a lot of work. But absolutely, and that's what I love about Joseph sharing his point of view in A Mother's Guide Through Autism. Through his eyes, the eyes of the guided, he talks about that and how thankful he is, that. And so the parents, and I know it's exhausting. I know it's hard. I've been there. I have done that, and you have too.
Yep.
And so yes, I would just encourage, don't give up, and just do your best.
Yeah.
Is that your advice for moms raising kids with autism, or do you have something you would like to add as advice for moms?
I would say that our children rise to the level of our expectations. And yes, there are limits on that to a certain extent. Like, they're not neurotypical, but they are capable of so much more than they may be showing us in any one moment. And going back to divine intervention, I remember sitting down with a woman from India who I think she was a prophet. Like, she was very prophetic. And this is before I was in a medical career. This is before we were just in the agony of getting the diagnosis. And she said to me, you are to think of him as a normal little boy. You are to expect things of him as you would a normal little boy, and he will be a normal little boy. And those words, I don't know, they went into my soul. And I didn't go to all the support groups. I didn't read all the sad books. I just said, you know what would I expect? What would I require of a normal boy? And I made him do it. And could he do it? No, he couldn't always do it, but he rose to the level of the expectation. And I've had other families come in and they said, well, the doctor or the teacher, someone said, well, you'll never be able to potty train that child or something like that. And then they go and they do it. And I'm like, see, it's the difference between those who are told you'll never walk again. They have the same spinal injury as the person next to them, but either you accept defeat or you say, you know what, I'm going to give it everything I have, because what if you didn't, So I guess that's the advice I would give, is like, expect the most possible. If they don't hit it, they still get farther than they did if you expected nothing at all and made excuses for that.
I love that. Yeah. Then that is great advice. And I have to say, I handled my I handled Joseph that way too. And it may have taken us longer. And just a small example of that was, with the potty training, absolutely he was delayed, but he's obviously potty trained, right? He's 30 years old now. It took him 5 summers to pass his swimming. But you know what? He passed it.
He did. Yeah.
He passed it. And now he's a great swimmer. And so I think exactly what you're saying, Julie, is that we just have to keep trying, and maybe it takes longer and we're on our own timelines, but that's okay, because they're building confidence along the way, because I assure you, he was very proud of himself when he finally got his swimming certificate.
Yes, absolutely.
Yeah. So I love that. Don't give up. Don't give up. And yeah. And treat them with that expectation. Is there anything you want to mention before we go?
Well, there's so much. I guess I would say to parents, consult with a functional medical provider, someone maybe who's MAPS trained, or someone that you know in your area or close by that works with people who are in similar situations, because there are so many things that you can administer at home that are going to make a difference. Whether it be even just something like a comprehensive multivitamin product that's created for children on the spectrum. And you can do that in the power of your own home. It's not, you don't have to drive necessarily to go to another therapy. So be willing to look into the power of the things that you have your hands on. So that's the power of food, it's the power of nutrients, and it's the power of knowing the doctors who know the biochemistry to say, okay, we want to focus on cognition and on speech development. Here's what we're going to do. I know it's expensive, but it's less expensive over time than all the therapies and all the assisted living care that you could be facing if you don't. So it's be willing to put that expense out up front as early as you can to get on a guided path.
Oh yeah, because once you start seeing the progress, it is worth every penny, right?
Yeah.
So I know that our listeners they're going to want to get in touch with you. So where can people find out more about your work and connect with you?
Sure. So I have a website. It's drjulielogan.com. And so some of my media productions are on there. And then I'm in 2 practices in the Chicagoland area. And there's information about where I'm at and when and who should go where. I work in Naperville with Dr. Anshu Usman. And that's where we do a lot of the biomedical interventions for children. That is where, people with medical complexity or people who need prescriptions would be best served. For those who are local or relatively close who are looking for holistic and nutritional interventions, the other practice does a really, really good job with that too. But we don't have prescription ability there.
Okay.
And just to be clear, I do not prescribe anything on my license, but if you're in a medical practice, then you have more tools in your toolbox available because the practitioners there do prescribe.
Great. That's also good to know. Wow. Well, I feel like this was so great. I think we hit knowledge, hope, and inspiration for sure in this interview. And I think there's so much more that you and I could talk about. So I hope you'll consider coming back and doing another interview in the future.
Absolutely.
I know you're a very busy lady. And so on behalf of all of us, thank you for being on A Mother's Guide Through Autism.
Thank you for having me, and thank you so much for the way that you reach out to the mothers on a heart level. It's precious.
Thank you. That's my honor for sure. And I want to say for all the listeners out there, if you enjoyed this episode of A Mother's Guide Through Autism, please like and subscribe to our YouTube channel. The more you subscribe and like and share, the more you're going to help us spread our knowledge, hope, and inspiration. And I will see you all in the next episode of A Mother's Guide Through Autism. Be safe and be well.